Hello, my name is Elena Semino. I work at Lancaster University, and I'm going to give you an example of some work that I have done using corpus methods in order to analyze a particular questionnaire that is used in many hospitals in the English-speaking world to diagnose chronic pain. It's a language-based questionnaire, and as you will see, there are questions, issues about it that can be addressed in part by using corpus methods. So what I'm going to do is, first of all, talk a little bit about the issue of communicating about pain, and particularly chronic pain, to contextualize the study that I'm going to present. Then I'm going to introduce the specific questionnaire that we worked on, the McGill Pain Questionnaire. And then I'm going to introduce the analysis that we've done, some of the preliminary results that show how corpus methods can be relevant to assessing and possibly improving questionnaires such as the McGill questionnaire. And then I'm going to suggest some things that we might do in future that you'll have to look out for if you continue to be interested in this kind of work. Okay, so pain. We're all familiar with it, and mostly it is unwelcome. However, pain is a basic human experience, and it's actually essential. It can be described as a warning mechanism that our body has to prevent damage to bodily tissues. So if you accidentally touch with your arm a hot iron, you instinctively remove the arm from the iron because you feel pain and the pain makes you react. And indeed, there is a genetic condition where people don't have pain, and it turns out it is very difficult to live without the mechanisms for pain, and people with that genetic condition have all sorts of problems. However, pain is not easy to express in language, and this is well known, including by the medical professionals who work with people who have pain, especially chronic pain. And there is a particular type of pain that the questionnaire I'm going to talk about is to do with, that is particularly hard to communicate. So, just very briefly, there are two basic types of pain. One is known as nociceptive pain, and it's the kind of pain that you experience as a consequence of damage to the body. So the example of getting a bit of your skin burnt would be an example of nociceptive pain. There's damage to a bit of bodily tissue and you experience a sensation that is unpleasant, and that makes you react in a way that protects your body. However, there are other types of pain that are not quite so straightforward, known as neuropathic pain. Neuropathic pain is a kind of pain that you experience as a consequence of problems in the nervous system that are not directly connected with damage to bodily tissues. The most extreme example of neuropathic pain is phantom limb pain. It's the pain that people experience who've had limbs amputated, an arm or a leg, say, and they still have pain sensations in the limb they no longer have. So in that context, you can see it's an extreme case. There's some issue in the nervous system which leads to the sensation, but the cause of the sensation is no longer even physically present. And some chronic pain, including back pain, etc., might have both a nociceptive and a neuropathic component. Now, the neuropathic pain then is sometimes very difficult to diagnose because there is no obvious cause that might be detected either by the naked eye or even sometimes with scan or x-rays. And people who suffer from neuropathic pain, which is often chronic, so it persists over long periods of time, experience frustration trying to communicate their pain with their doctors, their families. They often feel disbelieved. And the doctors themselves sometimes confirm how hard it is to diagnose chronic pain, the causes of chronic pain from communication with patients. So there is a whole range of tools that are used to help the diagnosis of chronic pain of many different kinds, and today I'm just focusing on one, and that is the McGill Pain Questionnaire, which you should be able to see, which was created at a university in Canada in the 1970s. And as you can see, it includes 78 linguistic descriptors, things like sharp, cutting, lacerating, etc. 78 linguistic descriptors that can be applied to somebody's pain sensations. They're divided into 20 groups. Each group has between 3 and 6 or 7 descriptors. The groups are further divided into types that are not going to concern us in this particular talk. But the point is that the questionnaire was created in order to capture or enable patients to express both the quality of their pain experiences and the intensity of their pain experiences. So you'll be familiar with pain questionnaires which just focus on intensity. So they might give you might have a scale from 1 to 10 and you might be told rate your pain, assuming that 1 is no pain and 10 is the worst possible pain you can experience. That captures intensity, but it doesn't ask you to express what the pain feels like. In the McGill Pain Questionnaire, the idea is that because there are words being used, the words express the quality of the experience, and each group of descriptors that you can see in the questionnaire is aimed to capture a particular quality of the pain experience, but within each group, the descriptors are ordered according to intensity. So, just to clarify, and you can see that from the cutout from the questionnaire on the screen, group 3 includes pricking, boring, drilling, stabbing, lancinating. The idea is that all the descriptors capture a particular type of pain that resembles what you might feel if some sharp object is is inserted in your body, but they're ordered according to intensity. So pricking is at the lower end of intensity and lancinating is the most intense. And the same applies to the other groups. So in 4, sharp, cutting, lacerating, the idea is that sharp is the least intense, cutting and lacerating are more intense. So when patients fill in the questionnaire, they have to pick at most 1 descriptor from each group. But they can also say, no, none of the descriptors in this group applies to me. So the option is either you don't pick from a group or you pick 1 descriptor, and the clinician knows what type of pain you have and how intense that pain is. So from the point of view of the clinicians who use the questionnaire with patients, there should be 2 types of variation amongst these descriptors. Within each group, the descriptors should vary in terms of the intensity of the pain experience that they express. Across groups, the descriptors should vary according to the kind of pain they express, the quality of the pain. However, if you know how language works, you're probably aware that language is a little bit more complicated than that. So if you do a linguistic analysis of the descriptors in the questionnaire, you realize that there's actually more variation than that. I started working on variation in the questionnaire because I work with a clinician in a hospital in the UK who, like many other clinicians, uses the questionnaire but is concerned that some aspects of it don't work very well. Some of the descriptors confuse patients, some sections of the questionnaire don't seem to work in the way that they should. And so she and I started talking to each other, and she asked me to do some work on the descriptors themselves. By looking at the descriptors, I began to hypothesize that there is quite a lot of variation amongst the descriptors that potentially interferes with the job that the questionnaire is supposed to do. And in particular, the descriptors vary in terms of how frequent they are in English. They vary in terms of how many meanings they have. Not all of them are pain-related. They vary in terms of how often they're used in ordinary English to describe pain, and they also vary in terms of what kind of pain they're associated with in English. In order to investigate all those aspects of variation in English, you need access to a lot of language, and that's what the corpus provides. So I went to a very large corpus of English, the Oxford English Corpus, which has 2.4 billion words of English harvested from the World Wide Web. And it has a wide variety of genres, some more informal, such as personal blogs, some more formal, like extracts from books that are available online. And I started to look for each descriptor and its behavior in this large corpus. So, in terms of the things I found, first of all, I investigated frequency. How frequent are these descriptors in English? How much variation is there? Because potentially, the more frequent a word is, the more likely maybe people are to choose it, and if that's the case, that might interfere with how successful the questionnaire is in helping the diagnosis of pain. That's a hypothesis, but we can test it. Predictably, with 78 descriptors, there are large differences in terms of how frequent the words are in English generally, as represented in my very large corpus. So, for example, hot and cold, which are included in the questionnaire, occur about 200,000 times in my corpus, the Oxford English corpus, almost once per 1,000 words. At the other extreme, the questionnaire includes the word lancinating, which you may have never come across before, and you'll be forgiven for that because it's not included in any dictionary I know about. And in my corpus, it only occurs 15 times. But when I looked more closely, all 15 instances of lancinating are connected to the questionnaire. So in all 15 cases, the word occurs in the corpus because there are texts that talk about the questionnaire. So there is no evidence of any use of lancinating beyond the corpus. And indeed, when I've discussed this at conferences with health professionals, they say, oh, right, yeah, that's why people ask me, what does lancinating mean? Within each group, there are sometimes big differences there too. So in group 4 of the questionnaire, lacerating and, now we know, lancinating are rare words, but cutting and sharp are frequent. In group 10, tender is more frequent than taut, etc. So there's variation both amongst all 78 descriptors and within each group. Then let me consider another aspect of variation, and that is how often in general English is a particular descriptor used to describe pain. How strong is the association between the word and pain? You can do collocation analysis of various kinds. I have done, in collaboration with one of my PhD students, Enrico Torre, some very basic analysis, and that is I have looked at the number of occurrences of the word pain specifically in a window around each of the descriptors in the Oxford English corpus. So if I take a window of 5 words to the right and 5 words to the left of each descriptor, I find that there is one word, the word rasping, which is included in the questionnaire, where there are no instances of the word pain in that window anywhere in the corpus. At the other extreme, the adjective sharp has 986 occurrences of pain within that window, 5 words to the right, 5 words to the left. 28 descriptors out of 78 have 10 or less instances of the word pain in that window. I also tried increasing the window, and of course with rasping there are still no instances. With sharp there are more instances, 1,136. So there's a lot of variation in terms of how often the word is used in English to describe pain. And overall, if you take that bigger window, 10 words to the right, 10 words to the left, 11 descriptors still have 10 or less instances of pain in this whole very large corpus. So I'm going to end this first part of my presentation on the McGill Pain Questionnaire by asking the question that we then asked, which is, okay, these descriptors vary a lot in terms of how they function in English, and particularly they vary in terms of how frequent they are and how strongly they are associated with the word pain. The next step is, does that matter? Is there any evidence that the presence of this variation within the questionnaire that is not part of what the clinicians want to test, does that get in the way of the reliability of the questionnaire? And that is the next step of our study that I will present in the second part of my presentation.